All right, so thank you. We are at the end of our web symposium and this mini format. I think we learned that there is a lot of technologies already available, and this was basically the scope of this web symposium. Not thinking about the future, but thinking also about what is available now and what are the tangible opportunities we have in terms of digital diagnostics, but also diagnostics or biofluid diagnostics. And then we go into therapeutics, but in particular also prevention. And I think that this was really what we aimed today, because in general, this field is quite pessimistic, going back and forward. And I believe that indeed there is much that we are doing, but there's probably not enough emphasis. And I think that this was basically the message that I wanted to give. Maybe Irene or Bogdan, you want to comment on this? We saw a lot of technologies which, there are companies out there in the US, in Switzerland. I mean, we had 2 companies on digital therapeutics, which are already treating subject with cognitive disability. So,
Irene?
Yeah, absolutely. I think it's a fascinating field, and I myself come from this field of neuropsychology and assessment and paper pencil assessments, and I'm fully aware of the limitations. I think there's a big change, and in this regard, I think the pandemic has helped as well to really push forward this transition to digital health, even telehealth as well. I think this is something that has been a long time coming. Some of the problems are that we don't know yet how to handle certain either data or privacy rules, and then how we deal with that also in different regions. Mm-hmm. And then I think one of the major challenges, and that I was in an AI cognitive digital webinar yesterday, and the discussion was revolving around how to create a tool as well for even just as simple as a screening tool for cognitive impairment or decline that serves all population. And that means highly educated people in high resource countries and regions, and then people with lesser education or different types of education, different language, different sociocultural and economic background, let's say in rural Brazil here, where not everybody has access to a doctor. So I think these are some of the main challenges that we see. And then on the other hand, also regulatory-wise and data privacy-wise, I think these are the major limiting factors right now. But it's been definitely a great push into the right direction. And I'm very glad that we had a few companies today. There's lots of them out there. Yeah. And so I'm really excited to see what the future brings. But there has been a great development, also lots of investment, private, also public funds, also like ADDF, the Gates Foundation, and Gates Ventures are also kind of going into that direction. So there's a lot of support out there. And it's actually a really exciting time to be active in this field.
Well, if I may say something, it was an amazing, rich discussion. And for me as clinician, I would be also following your main directions, Irene. I think now facing the first provisionally approved, FDA-approved disease-modifying drug, we will face, of course, the challenge of diagnostics, right? I mean, we in clinics, we are good, but I think having also a richer armament, particularly covering this more ecological domains outside of the hospital, this will give us really, I think, the sharpness eventually to get the patients in a preclinical stage, which is the majority of cases required for this type of treatment. And then I'm not that worried about data privacy, because at least you see there is the push at the level of the European Union to create this digital health space. That means although I think the GDPR, etc., actions were right for our type of work, particularly having also the confidence of the population towards what we do. I think this initiative of the European Union is in the right direction. And I'm also very curious what will be the future. But I definitely think this is clearly a quantum leap now in the way how we see individuals, not only as a patient in a room, face-to-face to a doctor or a nurse or neuropsychologist, but much more interacting with the environment. And this is, I think, the richness of everything what we heard today.
Yeah, I think that the remote journey will increase, right? So, and this will be a great advantage because we will truly be able to do monitoring and discover also new biomarker in the end, right? So this isolation that we have been living upon in the past 2 years now, I think it brings about a lot of opportunities for distant monitoring, and only at some point you will end up to the hospital. But I think it will be quite late if you will be able to do actionable preventive measure or therapeutics, and you will fall in one category. I think this is really the way to go, and this is what we hope for the future, where you know, the burden, the healthcare burden, but also the stage where you're in, where it's basically resolvable. Well, this stage is as late as possible because you've done everything you could, even at the level of therapeutics, before you end up in the hospital. And yeah.
I just want to add to that. I think it really nicely adds to what we heard also in the beginning of the talks. And I think this effort of like giving healthcare back into the hands of the people, the actual patients. There's two ways that we can use digital biomarkers. One is the active one, where the patient really goes in and gets tested. And then we have the passive digital biomarkers that are like smartwatch and Fitbit and whatever. And like that, we get such a wealth of real world data. It's going to take us a while to figure out what's important and relevant and how does it relate. But that will connect us back to large scale kind of finger study type things. Okay, you know, the person stopped walking. We have to understand why they stopped walking 10,000 steps a day. But we'll get like a disease history basically, and that distinction. And I really like that this came up in the discussion today, the distinction between healthy aging and non-healthy aging, because it depending on the definition you look at it, there's a difference. Is a patient healthy that has amyloid in the brain but no impairment at all? Yeah. Is that patient already kind of like impaired? Should we start treating them there, or are they still like healthy? And so I think this is a really important question. And my hopes are that with these digital tools, whether they're active or passive, or not necessarily only digital, but more digitized and away from the paper pencil tests that usually come too late and they're a big burden for patients, we'll have the opportunity to monitor patients way earlier and then also intervene. And whether that's going to be with drugs, with lifestyle modifications, and I think it should be all of the above. I think somebody said it's like not a hopeful or like a sad discussion, but I actually think it's we're at a turning point. At this point, I'm very excited.
Yeah, I totally agree. I cannot see this closer than you, and I think that we should also avoid to have this dilution of data, though, because it could be that we are losing a lot of data, and many people are using like maybe not the right apps, not doing the right things, and there should be this data should not be lost. As we are starting collecting data, it should be somehow a little bit more funneled towards the understanding. And this is, I mean, what we are doing in retrospective study, that we go and analyze data and we all of a sudden say, oh wow, there's really a connection between cardiovascular disease and Alzheimer's disease. It's not, it's not a pure neurodegeneration, but it has a lot of physiological factors that do influence. So I think that there is a need maybe to think how in the future the regulatory bodies are going to use this data, because it would be a pity to lose it now that we have it.
Well, but another aspect, I mean, I don't want to become very polemic, is also the accessibility of such devices and also software. Because we can imagine the people with this kind of gadgets around their wrists, etc., more the individuals who are earning a certain amount of money, living in certain countries. And we should be also thinking how to avoid inequalities, particularly when we know that the most vulnerable also for neurodegenerative diseases are the socially deprived.
Yeah, definitely. Yeah, so I mean, probably the biomonitoring should not be exclusive, right? So it should be inclusive biomonitoring. You're absolutely right, and I think that's and we have to think about this for the next meeting, maybe inclusive biomonitoring and trying to see to learn maybe from low resource country how they do it, how they're able to implement some probably easy, convenient tools in order to go early on and check people's health in general. And of course, we probably they eat better than us, but still, Alzheimer has no, or neurodegenerative diseases, they have no boundaries, unfortunately, right? So I would like just to thank you, Bogdan and Irene, for wrapping up. And I would like to thank the InnoSwiss that has allowed us to do the 3 symposia together. We are in a mission here. We don't forget this. We always think about Brain Fit for Life as an advocacy campaign for improving investment in research in this field in Switzerland. And I think we are going in the right direction. It has been a challenging time for us all, but I'm confident that in the next year we can get back together and talk about all the things we haven't talked about, and do maybe a longer meeting next time. This was a rather short format that due to my commitment also to the Institute had to be put in place. But I would like to thank all the speakers who agreed to be today, and all the people who have registered. By the end, we didn't have so many people, but I think that it's normal. It's a long day, a long afternoon, and so I thank everyone, and I would close the session. Thank you. Thank you, Bogdan and Irene. It was always a pleasure to
likewise. Thank you very much.
Work together. Bye-bye.
Thank you. Bye-bye.